Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from Tampa, Florida, and the Moffitt Cancer Center. We were graciously invited to join the CancerX leadership meeting and have several of their leaders joining the show to launch our new Cancer Innovation series. Many thanks to my good friends, Dr. Kamal Jethwani and Dr. Nanish Parikh, for the hospitality in making this on-site location series happen. This Cancer Innovation series was initially derived from a conversation last October at the health conference in Las Vegas, where I became very optimistic about the strides in cancer care, innovation, and patient outcomes. As we were outlining these episodes, it became even more obvious why we need to tell these encouraging stories about innovation, survivorship, and curing cancer. I hope all of you find these episodes as enlightening and encouraging as me, and I expect to host a follow-on series later this spring, so stay tuned. And for my next segment in this Cancer Innovation series, please welcome President and CEO of the Moffitt Cancer Center, Dr. Patrick Hu. Thank you very much for joining us today and welcome us here on your facility. So from your perspective, what recent innovations in cancer are you most encouraged by, and why do you believe they're meaningful?
Well, there's a lot of innovations in cancer we're very excited about, Justin. We feel that the science is so good now that we are getting better treatments every day. Our patients can live longer and have fewer toxicities. We're really excited about immune therapies where we stimulate the body's immune system against cancer. And we're excited about that because these immune cells can go and touch cancer cells, recognize them, release proteins, kill them, and then go to another cancer cell. And these immune cells can live in the body for decades. And so giving patients what they really want is a long-term durable response so they can see their kids grow up, their daughters down the aisle, meet their grandkids. That's what it's all about. And at Moffitt Cancer Center, we're really excited about T-cell therapy.
Absolutely. Well, so Dr. Jethwani and I last night were talking about T-cell therapy. Talk a bit about that to my audience about innovations there, but also the excitement around that.
So T-cell therapy you can do in a number of ways. We all have T-cells. T-cells are here to fight viruses. But we've learned to arm the T cells with genes so that they recognize the cancers. And so I think there's a lot of ways to do this, but we can take immune cells out of the body, put genes in them, have them recognize the cancer to kill them. And sometimes the immune cells get turned off in the very nasty battlefield of the tumor. We call that the tumor microenvironment. So we're also learning to change their metabolism with genes. We're even using CRISPR to cut out genes so that they work even better. So these are the kinds of things we do at Moffitt, where we've treated more patients with T-cell therapy than anybody in the world. Yes. And we also have a gene therapy suite where we can make the genes to clinically give them to patients and modify their immune cells.
Yeah, and then this conversation specifically, I had at a high level at the HLTH conference last year with Dr. Jethwani, and I got very excited. And that's where the whole cancer series spurred from that conversation. And also I wanted, this is a very encouraging message, and this is why I want to start talking about this more. I'm going to actually dedicate a chunk of 2026 of my radio show to what you guys are achieving, but also the very positive message around this, and also the survivability of cancer. I think is when we naturally think as patients, just general patients in the industry and community, we sometimes feel it's a death sentence, and it's absolutely not. And that's the kind of message I want to get out there. It's just very encouraging.
Yeah, I think what we have to remember, Justin, is cancer is, hundreds of diseases.
Yes.
And we're making more headways in some than others. The disease I treat is advanced melanoma. That's a disease that starts on the skin and goes throughout the body and can attack many different organs in our body. That used to be uniformly lethal. 15 years ago, 95% of my patients would pass away within a year. Now over half of them are getting long-term durable survival. I'm becoming good friends with them because talking about the kids, and they're just seeing me once a year and getting a checkup. They're essentially cured because we're stimulating their T cells against the cancer.
Right. I love that, and thank you for sharing that message specifically, because that's right. I think up to 70%. Again, I don't want to start mixing numbers, but I think 70% of cancer is either treatable or curable. Is that correct, ballpark?
It depends on the stage and
Right.
the type of cancer. And we also have to remember, Justin, that 40% are preventable.
Right.
So
There
if
you
we
go.
can try to prevent, no one should smoke, we should watch our weight,
Yes.
watch the sunburns. We do that, we can watch alcohol. We do that, we could prevent a lot of the cancers in the first place. And then we can get even more of them by early screening and detection. So there's a lot of things we can do to cut this death rate down, but there's way too many deaths from cancer.
Right, and that also is a very encouraging message there. So what are you personally working on today that you're most passionate about, and how does it connect to improving cancer care or outcomes?
Well, my own lab works on T-cell therapy, but as an institution, we're working in all the different areas. One area is nutrition and food. We set up a whole nutrition kitchen.
Love that.
Because food is a very important method to prevent cancer, but also treat cancer. Mm-hmm. We're finding that if you have enough fiber in your diet, you can fuel what's called the microbiome, the bacteria in the gut, to help your immune system fight cancers like melanoma. But yet a lot of the research in food is not that good. It's based on surveys. It's like, Justin, how many hamburgers did you have over the last year?
Right.
I mean, do you remember?
Yeah, probably about 7. Not many. So I believe in food and food health. So yes.
Yeah.
So, yeah.
So, but no one remembers that, right? And so we have a food kitchen.
Right.
You guys should visit it.
Absolutely.
Where we know exactly all the macros, and we give the volunteers and the patients all their food and snacks for several weeks. We measure the microbiome. We measure the blood for the immune response. We're really understanding prospectively how the diet is affecting health. Yes. And that's really the kind of prospective data that's needed to determine what the answer is to the most common questions my patients ask me is, what should I eat?
Right. Yep. No, fascinating, and I love that. And I've studied that. The only reason I kind of know my number ballpark is because I've taken this very seriously over the last 10 years. I know food is directly related to health. Alcohol intake, smoking, all those type of social factors. So I've been able to change my life pretty dramatically in that area. So I have this great longevity. I have great genes. My grandmother lived to 98 and a half. But I also want to make sure I make it that far, just because I have great genes, social factors and other come into play. So, I've taken it very, very seriously on my side. So, and I love the fact that you guys are attacking it not only from a medicinal side, from a treatment and drug, but also food. Very, very important. So we will absolutely check out the food kitchen. What are your goals for CancerX? We're here specifically today because of CancerX and the leadership meetings that are occurring, but what do you hope to accomplish in 2026 or help to accomplish in 2026?
Well, I think we should scale our effort. At Moffitt Cancer Center, we know our outcomes are better than most centers around the world because all we do is cancer. We have specialists. We have 10,000 people just focused on cancer. We don't treat heart disease. We don't treat Alzheimer's. We treat cancer. So our cancer outcomes are second to none. But there are 10 million deaths globally to cancer every year. So we can't treat everybody in the world. So how can we scale that? We're going to do it digitally. And so that's how we love CancerX because out of the hundreds of companies that want to be in the incubator, we have a dozen or so every year that come. They get coached, they get sponsored, and hopefully out there to scale healthcare so that we can get better outcomes for patients across the globe. And we've had some success stories. Really excited about that. And this is the third year we've had the accelerator, and we want to just keep scaling it every year. But this is how we're going to scale our effort to help even more patients.
Right. And I think what's exciting that I heard last night during one of our events here was how we're really shifting care from getting the right people into the hospital that needs to be here, but then shifting the care that could actually be in the outpatient setting, the AMC, or the ambulatory medical center, or the home, hospital at home. So I know you guys have been great leaders in that nationally, but talk a little bit about that, the shift from the hospital to the AMC to the home, if you would, for a moment.
Okay, yeah. When I talked about 15 years ago when I was treating advanced melanoma,
yes,
and 95% of the patients would pass away within a year. The treatments we gave were in the intensive care unit.
Right.
I was giving treatments that sometimes caused patients to be on the ventilator. Right. And so now the treatments are outpatient. Most of my treatments are in the infusion center.
That's great. Yep.
Or they're pills that I prescribe.
Yep.
And so the intensive inpatient care, cancer care, is shifting to the outpatient setting, and the outpatient setting is going to soon shift to the home setting. Right. And so as we do that, we're going to have ways to communicate with patients, understand, observe toxicities, make sure we can get all the data. And that really is going to be through digital mechanisms.
Absolutely. Yeah. And also, I mean, you're improving outcomes while also giving a much better patient experience. The patients are at home, they're much more comfortable at home, and now we're seeing even better outcomes, certainly in a lot of cancer cases, when they're at home. So I love that. I love the work that you guys are doing in the innovation there. So looking into the proverbial crystal ball, what strategy, capability, or shift must CancerX make in the next couple of years to really accelerate innovation or outcomes?
Right. Well, I think they have to get uptake and help these innovative biotech companies. The challenge with it is the integration. Mm-hmm. So when they come in, and this is what the CancerX coaches and sponsors are doing. They're coaching them along. They're getting a playbook. It has to be a playbook for integration, because in healthcare systems, we have hundreds of thousands of patients on a plane in the air that we treat every day.
Right.
We can't plug in an innovative solution that tanks the EHR and everything comes to a grinding halt and harms a lot of patients.
You got it.
So we have to de-risk that. We can't put in an innovation that's going to cause cyber worm to come in and shut down our operations, right? And so what the CancerX, we're trying to help these companies do is develop a playbook of integration such that we can have them make sure they're cyber secure, make sure we can try to standardize the legal entries into these systems. We have to try to standardize the integration. We have to communicate to these systems the awesomeness of innovation and why they have to be innovative, and also not sugarcoat the integration. It takes real energy to integrate, and a lot of the effort is in the integration with your current EHR and other systems, and that is doable. Absolutely. But it's not something you just pull out of the box and plug in. So we have to communicate that, standardize it as much as we can, try to help these companies with a playbook. That way they're going to go out there and be successful with these systems.
Yeah, I love it. You nailed it on the head. And actually, technically, that's where the conversation initially started, again, last fall with Dr. Parikh and Jethwani, because I spent a lot of time even on Capitol Hill creating standards for interoperability of this data. And so we had a thought, and I think this is debatable, and this is actually where this series came from as well, is we believe for many, many years, actually if not a couple of decades now, that we actually could cure cancer by just by accessing the data that we have stored in silos. We have hundreds of thousands of silos of data across the country, and even in a lot of cancer centers, because we don't have a lot of the interoperability. So since we actually have tons of data locked up, and if we start sharing that data, we'd actually be able to improve outcomes because we'd have access to all of this, again, data on treatments that have been, again, locked up in silos. Now, again, that's a big conversation. We're not going to tackle that now, but that's where the whole shift is. We need to unlock this information, securely share it. We need to make sure everything's secure, but also enable interoperability so we can start to look at data that may not be inside our facility, but we might have a decade-long experience or outcomes from all these different sources that we don't have access to today. So, and that's what actually Dr. Jethwani and Parikh and I are talking about kind of on the side, because, again, moving this interoperability forward is really important. But Dr. Wu, I appreciate your time. Thank you so much. And we'll certainly have you back. We're going to do another series up here probably in April or May. So we'll hopefully have you back again.
Thank you so much for all you're doing. And yeah, we need to come back because I have a lot to say about sharing of data. It's really not the unwillingness to share.
Right, absolutely true.
It's just we don't have the right systems to share, and the data is totally disorganized in these different entities. It's not shareable right now.
Absolutely true.
It has to be organized better. And the question is, how can we do that as a collective?
Yep. Well, we'll absolutely pick that up because it's a great topic for sure.
All right. Thank you.
Dr. Wu, thank you so much, my friend.
Thank you.
Appreciate it.